Okay. Okay, we are all set here now. All our technology glitches have been solved. Okay. Thank you. So I already mentioned a few things. My niece, this is my niece Misha. And like I said, I have no background in healthcare. I was shocked to hear the statistic about only 5% of rare diseases have FDA-approved drugs. And being from technology, we asked ourselves, can we leverage technology and actually legislation in the US to change status quo? Can we be different from patients like me? I don't know to the extent in an emerging field there can be a mini gorilla. I guess Patients Like Me has been funded to the extent of $140 million. You can ask me why we feel that's a different path they've taken, but we felt we could make a significant difference. So this is the graph I was showing about rare diseases, and the orange line is basically the populations of diseases, and towards the left are diseases with big populations. And traditionally, pharma has been there. We're talking about rare diseases. In the US, it's defined as diseases with less than 200,000 patients. There are 7,000 of these, so this is called a long tail. And the internet has solved many of these long tail problems, like Amazon can sell you anything, right? So, but rare diseases are really not rare. There are 30 million Americans with rare diseases, 350 million people worldwide, right? And it's a huge market, 100 billion like I mentioned, and the statistic from Uli, it was around 6% is the regular pharma market. This is growing almost double. And we felt we could make a significant difference in collaboration between pharma and patients. There are a lot of hurdles in the way. With rare diseases, with small populations scattered geographically, it's best for pharma to interact with patients on the web, but pharma is very wary of regulatory issues around FDA and privacy. Patient groups, almost all of them are on the web. They are very motivated but lack the technology to leverage some awesome strengths they have nowadays. That's where we fit in. We are the high-tech third party in the middle that wants to create a win for both sides. So this is kind of the schematic that shows how we work. Very important to note, we work with patient groups, not individual patients. Usually each of these patient groups have some people who step up as the leaders. A lot of times with rare diseases, patients and caregivers get beaten down, but there are a few people who step up, and it's important when you engage the group to have them on your side. And this is the model of almost all the other groups that are trying to organize patients. They just attract individual patients to their own websites. We don't have websites, we work with existing websites. And here what happens is that it's loose-knit individuals with no history of working together, no leaders. So what we do can change the paradigm, right? We work with patient groups on their own website, so there's no conflict of interest with them. We help them across a range of priorities that pharma may not be interested in because they're narrowly focused on a molecule. Like for instance, we have tools that help them raise funds. That's the number one thing that most of these groups need to do. We help them manage and conduct research. And drug development is super important, but there are other areas that patient groups need to research, whether it's standards of care, nutrition, living with the disease. And they have awesome power around data. Only patients can pull together data from all the silos. Only they can share it with others and consent. So the way we work really energizes these patient groups. And this is a quick schematic of, the patient on the left interacts with their, trusted website. We are in the background. Now I'm going to jump into a couple of case studies, first on the patient side. So cystic fibrosis is close to my heart, so we started out there. This is a group with 8,600 members. All they had done was a support group, and we helped them start doing research on the site. We helped the community, gave them tools on their website for community to suggest areas of research, and put them together with the top doctors from Johns Hopkins, Stanford, UCSD. The doctors chose the one with the best scientific merit. Again, the top 5 were again voted on by the community, and the top one now is a study is being done in Mayo Clinic. Okay. Then funding, we wanted to be innovative around this, so we helped them do crowdfunding and got them some grant funding. And pharma collaboration, they were doing a little bit of surveys and all for some pharma companies. Now what we're doing is we're using their site, and given our technology, our ability to access social media, search engines, it's a high-tech way for pharma to identify patients, and I'll show you a case study of that. And real-world evidence, like I mentioned, data only patients can aggregate from the various silos. There are some companies that sell data in this pharma sector. They aggregate data from EMRs, billing systems, wherever they can. Unfortunately, this data is incomplete, sparse, has errors because all this data is de-identified. And for some big diseases, it makes sense. For rare diseases, it does not make any sense. We source the data from patients, so it's valid data. So I'm going to skip through in the interest of time. You can look at this in our website if you're interested, testimonials. But I'm now going to jump onto the pharma side. How do we create a win for pharma? So Corcept Therapeutics is a company out of Menlo Park, and they have an approved FDA drug for Cushing's syndrome. Now, they find it very difficult to find patients, and I'll show you the methodology they use. But these patients are very, very valuable for this company. It's worth lifetime value of more than $1 million. And for this drug's benefit to be maximized to the company and to the patients, it is important to find these patients. And a thing to note is that for rare diseases, usually it takes 7 to 8 years, 5 to 8 years to even be diagnosed, right? Sometimes never. So now what they're doing is, they buy data sets, they do some algorithms on it, and then they reach out to pharma reps, reach out to doctors, educate them, interest them to find patients. Now, this is an inefficient process for them. And so what we are doing for them is, that we know that long before a patient is diagnosed, either the patient or the caregiver is desperately searching on the web. And our technology picks up the signals from search engines and social media and brings these potential patients over to a patient group website that we are partnering with. Not a pharma site, not a marketing site, it's a trusted site of peers. We give them the technology for these potential patients to quickly assess whether they could have this disease, and if so, it can only be confirmed by somebody who knows it, a doctor, so they can create a telemedicine consult, an appointment, right? So now, there's no mention of Corcept or Corlem in any of this. What they do is that they subscribe to this database in the end. So it gives them the buffer from FDA concerns. So this is how one way in which we work on the pharma side. So the idea is we leverage the strengths of all sides here. We bring the high technology around data, social networks. The patient groups bring the motivation. These are groups where literally children are dying for lack of drugs. And they're trusted, and they have the all-important ability to pull together data. Of course, pharma then knows about drug development. So how do we make revenue? Obviously, pharma is the deep-pocketed party in here. So this new patient identification, so for Corcept, each patient is worth $1 million lifetime, so it's in their interest to keep us as a channel. And we are still negotiating with them how we'll do it. We have some folks who are FDA, attorneys and all, regulatory lawyers who are helping us create a contract which insulates Corcept from FDA concerns. So this is new. This is a new kind of business we're creating. Real world data, again, I can give you instances of, it's very valuable for pharma. They pay millions. So that's end the line. And recruitment for clinical trials for most rare diseases, people know that, recruiting patients is super important. These are all, like Avik mentioned, not $1 billion, but usually several $100 million trials. We don't make money from the patient side. It's a no-brainer for them to work with us. But right now, when we do the crowdfunding, we do charge a little bit because we basically generate the crowd from the social network for them. And that pays for everything we do on their website. And this is some financial projection of what we do. The kind of revenue we can make. And this is based on these metrics at the bottom. And those of you who have heard of Guy Kawasaki, is pretty popular, Garage Ventures in the Bay Area. This is his methodology. It's based on these economic units. For us, on the driving metrics, new patient discovery customers, the one on 2017 is what we are doing with Corcept and Corcept, right? So it requires us, Althea, a drug company with one particular drug, and a patient group, the Cushing syndrome group, right? So then you project it, and like all startups say, these are very conservative projections. We'll have one customer each year. And the real world evidence, we are actually talking to multiple pharma companies now, but we've not put any right now in 2017. So this is what we are doing to date. If you notice, initially we worked with patient groups. The reason why we did that was because we felt if we went to pharma first, we will really not be able to create a win-win, which is what everybody else in this field has done. So we first wanted to create a win with patient groups, and now we started working with pharma, and Corcept is our first customer, but we are in advanced discussions with multiple pharma from Pfizer, Genentech, Sanofi Genzyme, and Takeda. And this is the competitive landscape, and the reason why we distinguish ourselves is, like you said, we work with groups. We don't work with individual patients. And if somebody starts asking about, go-to-market and all, how that helps, obviously we can go to a pharma and immediately find a critical mass of patients by working with the existing patient group. And then we work with those groups on many levels, funding and research and stuff that I talked about. So the motivation level is amazing. When we aggregate data, it's for something very important and precious for these groups. And this is our team. Myself, my background is mostly technology. Like Avik, I went to IIT in India. Had no healthcare background. I think that really helped to think outside the box in that. Ronnie is, on the patient side. We have Shah, who's years of experience, 10, 15 years of experience in the pharma side. And I have my CMO, he's an oncologist, AJ, sitting right here. So we have expertise from the medical side. And we have an amazing group of advisors. Like I said, Heidi is the FDA attorney. Mahindra has done multiple companies in this space. And Deepak out there is in the generic space. And we are raising funds. We are raising $1 million. We already have $780,000. We have some soft commits for a few more people. And what we'll use the funds for is to add 12 more patient groups on our network and conduct 2 pilot projects with pharma, which will allow us to go to the next stage of a Series A. And if any of you are seed investors, I would love to talk to you. So that's it. Any questions? I'd love to entertain them.
you.